This case is prepared by USMLE It will discuss numbness weakness case. Step 2 CS cases. A 60-year-old lady came to clinic, as the right side of her face feels funny since morning. Door information. Phyllis Brown, 60 years old Caucasian lady comes into the emergency room, as the right side of her face feels funny since morning. Vitals. Temperature is 97.4 Fahrenheit. Heart rate is 130 per minute, irregular. Respiratory rate is 14 per minute. Blood pressure is 140/90 millimeters of mercury. Oxygen saturation is 94% on room air. Let's review differential diagnosis. It could be due to TIA, stroke, due onset partial seizure, hypoglycemia. Let's review key points to remember. Doorway information, patient's name, age, sex, chief complaints, vitals. Duration of symptoms, to differentiate TIA from stroke. Mnemonic for stroke or TIA: fast, face, arms and legs, speech, time since onset. Ask for risk factors for TIA or stroke, for example atrial fibrillation, diabetes mellitus, hypertension, intracranial bleed, medications, for example warfarin, heparin. Ask for complete past medical history and medication list. Do thorough central nervous system examination. Opening scenario. An elderly white lady is sitting in chair with her right forearm supported by her left forearm. The right nasolabial fold is lost, an angle of her mouth seems to be drooping compared to the left side. She is unable to lift her right upper extremity or shake hands. History of present illness.
Hello, Mrs. Brown. My name is Dr. Lee. What brings you to the hospital today?
Doc, it's my arm and my face. They feel off since morning.
I see. Could you tell me more about this?
Yes, Doc. My right arm just feels so heavy I can't lift it. My face looked weird this morning. I kept dropping food while eating breakfast.
When were you completely all right, Mrs. Brown?
Last night I was fine, Doc. I woke up this morning with a heavy arm. Since then I don't feel good.
I see. How about your right leg? Does that feel heavy too?
Yes, Doc. And I feel like pins and needles pricking over both my arm and leg.
I see. Did you notice any changes with your vision?
No, Doc.
Your speech also sounds a little off to me, Mrs. Brown. When did this start?
Yes, Doc, you are right. It started this morning.
Do you feel weak or heavy in any other part of your body?
No, Doc.
How about the left side of your body?
It feels fine.
Have you felt dizzy since this started?
No, Doc.
Did you lose balance or fall suddenly?
No.
Have you felt sweaty when this started?
No.
Did you feel sick or throw up?
No.
Have you thrown a fit since this started?
No, Doc.
Any other abnormal movements of your body?
No.
Did you lose control of your bladder or bowel at any time?
No, Doc.
Have your eyes rolled up when this started?
No, Doc.
Pam hugs Foss.
Okay, Mrs. Brown. Let me ask you a bit about your medical problems and medications now. Have you had such a problem in the past?
No, Doc.
Do you have any medical problems?
Yes, Doc. I have high blood pressure. I am a diabetic and my heartbeat is irregular.
What medications do you take, Mrs. Brown?
I take the water pill, aspirin, a blood thinner, and 2 medications for the diabetes and a medication for the heartbeat. I don't remember their names. My daughter-in-law has a list. You can call her.
Okay, Mrs. Brown, I will call her after I see you. Were the doses of any medications changed recently?
No.
Are any of these medications new?
No, I have been on them for years now.
Are you allergic to any medication?
No.
Have you been hospitalized in the past?
Yes, Doc, once for a heart attack and years back when my children were born.
What work do you do, Mrs. Brown?
I am retired now. I used to be a teacher in elementary school until 5 years ago.
Okay, since this weakness or heaviness started, have you been able to do household chores as you normally do?
No, Doc, I couldn't even lift my arm. I feel so upset.
Have you had any surgeries?
No.
Did anyone in your family ever have a stroke?
Not that I know of, Doc.
How about your bowel movements?
They are fine.
And your bladder?
It is fine too, Doc.
Can I ask you a few questions about your social habits?
Yes.
Do you smoke?
No, Doc, I quit many years ago. I smoked in college, not a whole lot though.
Do you drink alcohol?
No.
Do you use any drugs?
No.
Physical exam.
Okay, Mrs. Brown, so your right arm feels heavier and numb since this morning. You also feel your face is a bit off, which it is, and you feel pins and needles on the right side of your body. You have trouble lifting your arm and leg, but your left side is just fine.
Right, Doc.
Okay, now I am going to examine you, and then we will go over my impressions.
Wash your hands. Drape the patient. Do central nervous system examination completely. Examine other systems quickly. Paraphrasing and closure.
So, Mrs. Brown, here is what I think. You are diabetic, hypertensive, and you have irregular heartbeat. And you came in with heaviness and numbness on the right side of your body since morning. My first impression is a stroke, or a mini stroke. Since you are on a blood thinner, a clot from your heart is less likely, but we still don't know if there might be one. You might have bled into your brain, or just outside it. We will need to do a CAT scan of your head to know. Another possibility is that you had your diabetic medications but didn't eat enough. So your sugars dropped too low, and you felt numb and weak. I will have some tests run on you so I can't say what it is for sure.
Okay, Doc.
We will draw blood for some tests and you will have a CAT scan of your head.
Okay, Doc. They did the CAT scan already.
Okay, great. I will go over the results of the blood tests and take a look at the CT and come back to see you. Then we will talk about what I think and what the further plan is.
Okay, Doc.
Do you have any other questions or concerns?
No, Doc.
Patient note. A 60 years old hypertensive, Diabetic Caucasian female presented with numbness and heaviness of her right arm since this morning. The right side of her face also felt numb. She reports being in her usual state of health until this morning, when her right arm felt heavy and she couldn't lift it. Her face also felt funny and she had pins and needles sensation on the face and right upper extremity. She kept dropping food while eating, and her husband noticed her mouth was drooping. She also reports muffled speech since morning. Patient denies any seizure activity, loss of consciousness, loss of balance, fall, incontinence of urine or stools and uprolling of eyes. She also denies weakness in any other part of her body. She denies nausea, vomiting, dizziness, changes in vision or feeling sweaty. Her medical history includes hypertension, diabetes mellitus type 2, atrial fibrillation. There is no past medical history of stroke or TIA. Denies family history of stroke or TIA. Her medications include diuretic, aspirin, 2 oral hypoglycemics, warfarin and a rate control agent. She is unaware of their names and dosages. No new medications have recently been added and no doses have been changed. Physical exam. Elderly white female in no acute distress. Speech slurred. Unremarkable general examination. Central nervous system, alert and oriented to person, place, and time. Right side face, weak, sensory loss over cheek, angle of mouth and nose. Nasolabial fold on right side is lost and angle of mouth is drooping. Patient unable to close her right eye fully. Bell sign positive. Sensory, losses over right arm, forearm and hand. Patient reports numbness in these areas. Deep tendon reflex, right plantar extensor, left plantar flexor. No losses on left side of the body. Respiratory system and cardiovascular exam unremarkable. Data interpretation. Diagnosis 1. TIA. History findings. 1. Sudden onset of right arm weakness and numbness of right face. 2. Difficulty in swallowing and hoarseness of voice. 3. History of atrial fibrillation, hypertension, diabetes mellitus, ex-smoker. Physical exam findings. 1. Right arm weakness. 2. Cranial nerves deficits, right face numbness and swallowing difficulty. Diagnosis 2. Ischemic stroke. History findings. 1. Sudden onset of right arm weakness and numbness of right face. 2. Difficulty in swallowing and hoarseness of voice. 3. History of atrial fibrillation, hypertension and diabetes mellitus. Physical exam findings. 1. Right arm weakness. 2. Cranial nerves deficits, right face numbness and swallowing difficulty. Diagnosis 3. Hemorrhagic stroke. History findings. 1. Sudden onset of right arm weakness and numbness of right face. 2. Difficulty in swallowing and hoarseness of voice. 3. Use of aspirin and blood thinner, Coumadin. Physical exam findings. 1. Right arm weakness. 2. Cranial nerves deficits, right face numbness and swallowing difficulty. Diagnostic studies. 1. Comprehensive metabolic panel. 2. Complete blood count with differential. 3. CT head non-contrast. 4. EKG, 12 lead. 5. echocardiography. 6. Carotid Doppler. Additional diagnoses. You might consider additional diagnoses based on patient's presentation. Here we have also included possible history and physical examination findings for them. It would be helpful, when you have little bit different presentation than it was mentioned in this case. Data interpretation. Diagnosis. Hypoglycemia. History findings. 1. Use of insulin and oral hypoglycemic and skipping meals or use of higher dose. 2. Sudden onset of sensory or motor deficits along with palpitations, sweating, blurred vision. 3. Low finger stick at the time of symptoms and relieved by IV dextrose. Physical exam findings. 1. Motor and sensory deficits. Diagnosis. Seizure. History findings. 1. Sudden onset of jerky movements. 2. Postictal motor weakness and numbness, which lasts from hours to days, postictal confusion. 3. History of seizure or risk factors, recent stroke, electrolytes abnormalities, hypoglycemia. Physical exam findings. 1. Sensory and motor deficits. We wish you happy reading.